always my intention is to share knowledge and gain knowledge. So what is IVR, guys? Anyone knows IVR?
Radiology.
Yes, IVR means interventional radiology. So first we will learn basic. What is IVR? So IVR is a two-part medical service requiring surgical and radiological support for completion. Okay. So without radiological support, you can't call it as IVR. Okay. Why means the IVR itself contains radiology code. Okay. So without radiology, you can't code it as IVR. And as most of the companies are providing higher salaries for IVR coders as well as work from home jobs, as IVR is very complex topic. Okay, so everyone can do general surgery or specialty type surgical coding, but IVR is very complex. So that is the reason high demand for IVR coders nowadays. So in IVR we have two types of procedures. Okay, first one is diagnostic, second one is therapeutic. So what is diagnostic IVR? The art or act of identifying a disease from its sign and symptoms. Okay, for example, patient is having the stenosis. Okay, so patient is having leg pain. So physician wants to identify what is the reason for patient's leg pain. So that time physician will perform angiogram and he will identify the patient's disease. Okay. So next one is therapeutic. So for example, same patient is having the leg pain. Again physician will perform the angiography. So during the angiography, physician will identify the stenosis. Okay. And physician will perform the angioplasty or stenting based on the stenosis complexity. Okay. So here in IVR, most of the time physician intention is to identify the disease. Okay. So during the process, if the physician identifies any disease process, physician will convert into therapeutic or surgical IVR. Okay. So basically here we have diagnostic IVR as well as surgical or therapeutic IVR. So these are the things physician will do while doing the IVR. Okay. So next, in IVR we have two components as we have discussed just now. So the surgical component, the process of involving manipulating the anatomy to reach the intended outcome. Okay. So in order to reach the intended site or intended outcome, physician will use the surgical component. During the radiological component, the process involving utilizing radiological images to reach the intended outcome. Okay. So using the surgical component, physician will manipulating the anatomy. Using the radiological component, physician will utilize radiology images to reach the intended outcome. So that is the purpose of surgical component as well as radiological component. Okay. In surgical components, mostly in vascular, we will have 3000 series or 30,000 series codes related to arteries and blood vessels. Okay. And radiological component, mostly we will use 7000 series or 70,000 series from the radiology. Okay. So next, this is one example for IVR coding. So this is 37184. So this is for mechanical thrombectomy. So here the code description of mechanical thrombectomy 37184 is primary percutaneous transhumeral mechanical thrombectomy, non-coronary, non-intracranial arterial or arterial bypass graft, including fluoroscopic guidance and intraprocedural pharmacological thrombolytic injection initial vessel. Okay. So whenever we see any code description, we need to identify three terms where physician is performing the procedure. what is the anatomical site. Okay, intended outcome. So here mechanical thrombectomy is the intended outcome. So here basically physician wants to remove the thrombus. So that is the intended outcome. And approach. So what is the approach in this scenario? So here approach is percutaneous. Okay. So whenever we have IVR code, we need to check all these three components: anatomy, intended outcome, and approach. If you identify these 3 points in the IVR code or 30,000 series code, you can code very easily. Okay. So this 37184 is related to surgical component or therapeutic component. Okay. Yes, thrombectomy is a therapeutic procedure, not a diagnostic procedure. Okay. So next we will see radiological part. Okay, why physician will use radiology here? For imaging guidance, as most of the 30,000 series codes are useful for arteries and veins. Correct? So it is not possible for the patient to see those arteries and veins with his naked eye. So that is the reason he will use the radiology for imaging guidance, for road mapping, as well as diagnostic evaluation, as we have seen previously. Okay, so whenever you want to code radiology part, you need to choose based on anatomy, intended outcome, as well as technique. Okay, so again we have an example here going further. So this is the example for radiological component. So here also same 76937, so which is for ultrasound guidance for vascular access requiring ultrasound evaluation of potential access sites, documentation of selected vessel patency, concurrent real-time ultrasound visualization of vascular needle entry with permanent recording and reporting. Okay. So what are the key things you need to check in this code? First you need to check anatomy, where physician is performing this procedure. So here they have mentioned, here it is vascular access. So most of the time, or 90% or 100%, we need to use this code for vascular procedures, not for non-vascular procedures. Okay. So intended outcome. So why physician is performing this ultrasound? Okay. Just here physician wants to check vessel patency, whether vessel is like stenosed or thrombosed. So that is the intended outcome. Next to technique. So what is the technique physician using here? So physician is using ultrasound. This is the basically real-time ultrasound. Okay. So along with surgical component using the 30,000 series, physician will use ultrasound also. So that time we can use 30,000 series code as well as 70,000 series codes. Okay. So this is the information related to surgical component as well as radiological component. Okay. So here in catheterizations, we have vascular catheterization. So mostly these are related to blood vessels. So those codes are 36000, 36425 and 37184 and 37249. Okay. So these are mostly related to blood vessels. And cardiac catheterization we have 92920, 92979 and 93451, 93458. So here physician will place catheter into the heart. Here in top one, physician will place catheter into the blood vessels. Okay. So that is the difference between vascular as well as cardiac catheterization. So next, so any doubt guys here? So during our training, so you will learn all these things. Mostly as we have discussed, you will learn about mostly vascular IVR. Okay. Why means non-vascular IVR anyone can code. That is very easy. So you will learn only vascular IVR. So first you will learn what is the difference between non-selective as well as selective catheterizations. Okay. Next you will learn how to identify vascular family and what are the orders. How to identify first order, second order and third order. Okay. And how to identify if the physician performs procedure in or catheterization in multiple families. Okay. And also you will learn 2026 lower extremity IVR coding guidelines along with practical scenarios. Okay. Next you will learn thrombectomy scenarios. What is thrombectomy? What are the codes we need to use for thrombectomies? Okay. Next, embolization. So what is embolization and how to code embolization? So whether catheterization included in the embolization or not. So those things you will learn. Next you will learn dialysis circuits. Okay. So how to code like dialysis circuits. What is the difference between AV grafts and AV fistulas? Okay. So and also how to code dialysis circuits using 369012 to 36909 series. Why means these dialysis circuit procedures are very important in IVR coding. Next, IVAS. So IVAS means intravascular ultrasound. Okay. So during the procedure, physician will use intravascular ultrasound also. Okay. Next you will learn TEVAR, EVAR and FEVAR. So basically these three procedures for aneurysm repair. Okay. Next you will learn Appendix G. So Appendix G is the like cheat sheet for IVR coding. So if you are able to understand Appendix G, you can code any IVR chart easily. So most of the time Appendix G is useful for diagnostic IVR or catheterizations. Okay. And also you will get 100% real-time live charts. So you will practice 100% real-time live charts. So here I will provide the live chart and I will ask you to code after theory. Okay. So after, if you are unable to code, I will explain how to code these scenarios. Okay. So those are the things you will learn during this training. Okay. So thank you guys. So any questions here?
You mentioned, right? Is there any other branch